Prostate cancer is the most commonly diagnosed cancer in the UK, yet half of cases are diagnosed late. I'm here at the Bath Prostate Centre to speak to some of our leading consultant urologists and clinical oncologists to answer your questions about prostate cancer.
What is prostate cancer, and is it really that common? Prostate cancer is a common disease. It affects men who are predominantly older. It's one of the most common types of cancers, and it affects over a quarter of all men with cancers in the UK. And over the last few years, around 130 new cases are diagnosed every single day. Are some men at more risk than others? That's a really good question, and it's commonly asked. That is very much true. Men who've got a family history of prostate cancer or certain other types of cancers, such as breast cancer in their side of the family, are at higher risks. Certain ethnic groups as well can be at slightly higher risk, for example, African American men. Does prostate cancer always produce symptoms? Prostate cancer doesn't always produce symptoms. In those men in whom prostate cancer does produce some symptoms, those symptoms may mimic those that are related to non-cancerous conditions. How is it diagnosed? For the majority of men, the diagnosis is based on a blood test called PSA, related to a physical examination and taking a summary of a man's background risk. At the Bath Prostate Centre, we have access to MRI technology, which will allow us to accurately image the prostate. Using this information and the images produced by the MRI scan, we can then determine whether or not additional assessment is needed. For some men, that will mean a biopsy. For other men, the scan will be reassuring and means a specific form of monitoring. At the Bath Prostate Centre, you will have rapid access to specialist review. Any assessment or treatment that you need will be individualised, and any diagnostics that are undertaken will be with equipment that you will have fast access to. The care that you receive will be based on specialist multidisciplinary approaches, and your choices and decision making will be shared and paramount to what's appropriate to you.
What are the options for treating prostate cancer? Fortunately, many men with prostate cancer can simply be monitored because they have low-risk cancers which are slow growing. And we can do that with regular blood tests, careful clinical follow-up and periodic MRI scanning. However, men with riskier tumours, there are lots of different options available, and choosing which one is best is quite a complex process depending on many factors. Most men will either end up having surgery to completely remove the prostate gland or some form of radiotherapy treatment. Are there any ways of reducing the risks of treatment? Here at the Bath Prostate Centre, we're always looking to adopt the newest technologies to improve patients' experiences during their treatment for prostate cancer. The latest example of that is the SpaceOAR. This is a hydrogel spacer that we inject between the prostate and the rectum to push them apart prior to radiotherapy treatment. It's done as a simple day case procedure and significantly reduces the risk of any radiotherapy side effects.
What are the side effects of radiotherapy to the prostate? Most men do experience some side effects with radiotherapy. A course of radiotherapy takes about 4 weeks for most people, and usually by the end of that time they have some irritation of the bowels and the bladder, maybe some diarrhea, mucus from the back passage, and a bit of frequency passing urine, but that normally resolves within about 4 to 6 weeks after the radiotherapy treatment. How long after radiotherapy treatment before I get back to normal activity? Well, I would encourage people during the radiotherapy treatment to keep normal activity as much as possible. In fact, many men come in for radiotherapy treatment in the morning. The process takes about 40 minutes a day, and then go off to work or to do other things. And I'm very keen on people continuing to be active and continuing to exercise. What's available if the cancer has spread beyond the prostate? We have a lot of new targeted drugs which work through the hormone pathway, and most of these are tablets and they're very well tolerated, and patients can have these drugs and carry on with a normal life, keeping their disease under control, often for many, many years. If I was to have chemotherapy for my prostate cancer, what would that involve? So chemotherapy is treatment with drugs which are given through the veins in most instances, and the usual schedule for prostate cancer would be to have a drug every 3 weeks, which we deliver here at the Bath Clinic. And that might be for something between 6 and 10 cycles of treatment. Most people manage to continue with a good quality of life through the treatment, and we have really good supportive medications which are available to help people manage the side effects. And we have excellent chemotherapy nurses here at the Bath Clinic who will give you a phone number to call if there's any problems or questions, and that's available 24 hours a day.
As one of the most common cancers in the UK, it's really important for us to know all the facts about prostate cancer. You can find out more information on diagnosis and treatment options at the Bath Prostate Centre's website.